Here we go, a brand new edition of Sports Medicine Weekly on this Saturday morning. How you doing, everybody? I'm Steve Kashul, joined by my usual co-host, Dr. Brian Cole. He is the head team physician with the Chicago Bulls, one of the team physicians for the Chicago White Sox, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. Hello, Dr. Cole.
Good morning, Steve. Good to see you.
How's everything?
Everything's great.
Good. Well, football continues, and some interesting stories, of course, in the NFL. How about one of our top quarterbacks? One quarterback a lot of Bears fans would like to have, Patrick Mahomes, of course, from the Kansas City Chiefs, and kind of interesting, dislocating his kneecap a few weeks ago, but seems so much more than that, right?
Yeah. So, well, it's interesting. So I got an interview. We had a story on the Action Network. And, there's a way to kind of figure this out. If you dislocate your kneecap and there's no loose piece of cartilage generated, we've gotten people back within 2 to 3 weeks. But not knowing actually what happened, if there's a loose piece and so forth, it could be 6 to 8 weeks if there's a loose piece and needs surgery. So in this situation, they sort of quoted the fact that he's, quote, double jointed. Now, that's not really a thing per se, but that means that his ligaments are normally lax. And
what does that mean?
Well, okay, so there's either laxity or there's instability. Laxity is sort of the general looseness of a joint, which is not necessarily a bad thing, by the way. And when laxity translates to instability, instability is sort of the abnormal extent of laxity. Does that make sense to you?
Yeah, it does.
Yeah, so too much laxity causing a problem is instability. So what happened to him, now that they've sort of added some more details in the media, is that he already has sort of this looseness around the ligaments and that stabilize the kneecap. He went to a new level where it became unstable, at least for one episode. So the upside of that is that it may not be associated with a ligament tear because it sort of stretches, and it may not be enough. There may not have been enough force to go into the injury that chipped off a piece of cartilage. So that is a much better prognosis, and the expectation is that maybe he's only going to be a couple of weeks rather than what people feared might be 6, 7, 8 weeks. It's a non-surgical management, and hopefully we'll get back. The fear, though, is that it could happen again, and that's what I typically see in our practice.
So if there was a loose piece of cartilage in the patella dislocation, how do you repair that with surgery?
So athlete in season or anyone you're trying to get back quickly, it's a simple knee arthroscopy where we make 2 little 1 centimeter incisions, look inside the joint, clean out the piece, grab it with a grasper, pull it out, and
I was going to say,
up.
do you pull it out?
Yeah,
okay,
sure.
All right.
Yeah, I must have done that, honestly, three or 4
times
last week.
Why does that need to be removed?
Because it's not, they used to call them joint mice. It's not good to have this piece floating around because it can damage other tissue, and it can get caught, and it can be very painful. And it can cause another injury. If it catches, you can go down just because of the fact that your knee sort of locks or freezes up.
That was my question. Is it painful having that floating piece in there?
If it doesn't catch anywhere, you may never know it's there. But patients, it'll range from not even knowing it's there to patients saying, I feel it underneath my fingertips through the joint, to it interposing and locking the knee, which can be very painful.
Really?
Yeah.
Interesting stuff. Wow.